For those of you who don't know, welcome to today's CTF's NF Knowledge Series webinar. This is a monthly series that CTF hosts that's designed for patients and families living with any form of NF. I'm Kate. I'm the VP of Research, Impact, and Engagement at CTF, and I am your host today and for most of these webinars. So a couple of quick housekeeping things before we get to our topic and our speaker. So first of all, closed captions are available today, provided by a live captioner. You can find that by clicking on the CC button that you should see at the bottom of your Zoom screen to make that available. Also, we do record these webinars and make them available. So if you wanted to go back and watch it, that will be available at the CTF YouTube channel. And it just takes a few days to kind of clean things up and make that available. Any announcements that I give today that have to do with visiting our website or going to our YouTube channel will all be pasted into the chat so that you can grab any links or copy and paste things that you're hearing that you want to be able to have for later. So again, a big thank you to everyone for being here today. I'm really excited to welcome our partners and friends from Alexion. They're here today sponsoring this webinar, and support like this enables CTF to continue to offer educational and informative content like this. So a big thank you to them. I'm going to actually hand things over now to Joe with Alexion, who's going to take it away and introduce our speaker.
Yeah, thank you, Kate. Hello and welcome, everybody. Thank you for taking time today to speak with us, and thank you to CTF for hosting today's NF Knowledge Series, national broadcast, discovering the possibilities of neurofibromatosis type 1, plexiform neurofibromas in adults. There's a lot to discuss and learn, and while we'll cover different topics, the most important things we'll talk about today is how to better understand NF1 plexiforms and how to better understand how treatment with Koselugo or selumetinib may benefit you. In this presentation, it's important to note that NF1 is short for Neurofibromatosis Type 1 and plexiforms is short for plexiform neurofibromas. Before we get started, I'd like to go through a few important announcements. For the privacy of fellow attendees, please refrain from capturing any recordings, photos, or screenshots of the presentation. And since you're joining us online, we hope that you'll make the most of today's experience by minimizing media and other distractions. If you get disconnected from this webinar, you can re-enter the program by following the instructions in your confirmation email from CTF. So looking forward to a great session, and let's get started. So like I said, my name is Joe, and I'm one of Alexion's dedicated patient education managers. At Alexion, our role is to help support people like you who are living with NF1 plexiforms. You may have heard Koselugo comes with a team, and I'm part of that team. Me and other patient education managers like myself are here as part of your support system, and we'll be here throughout your journey to answer questions, provide resources, and help you stay connected with the broader NF community. This includes meeting with you in person, both live or virtually, or to make sure that you have the information and support that you need. I'm joined today by Dr. Mina Lobbous, who has experience with NF1 plexiforms. He's been treating NF1 plexiforms for many years, and Dr. Lobbous is an adult neuro-oncology specialist at the Cleveland Clinic in Cleveland, Ohio, and he's going to be here to lead us today through many of the slides that we'll talk about. So before we dive deeper into Koselugo, let's take a moment to review the agenda and review the important safety information. So today's agenda, we'll be talking a little bit about the important safety information. We'll talk a little bit about Alexion's support system, as well as I'll pass it over to Dr. Lobbous at that point, where he can talk through NF1 plexiform neurofibromas, the data for adults, and the overview of the study data, Koselugo safety and how to take Koselugo, and then we'll wrap by talking a little bit more about a few more support resources, and then at the end we'll have a Q&A. It's important for me to note here that for the Q&A, Dr. Lobbous and I can only answer questions about Koselugo that are within the labeling of the medicine, and we can't answer specific questions to your condition. So just keep that in mind as you put your questions into the chat. So with that, let's dive into the important safety information, and I'll read through this, and then I'll pass it over to Dr. Lobbous. So Koselugo is used to treat adults and children 1 year of age and older with neurofibromatosis type 1 who have plexiform neurofibromas that cause symptoms and cannot be completely removed by surgery. It is not known if Koselugo is safe and effective in children under 1 year of age. Koselugo may cause serious side effects. It can reduce how much blood your heart pumps, which can be severe. Your healthcare provider will test heart function before and during treatment. Tell your healthcare provider right away if you experience persistent coughing or wheezing, shortness of breath, swelling of your ankles and feet, tiredness, increased heart rate. Koselugo can cause eye problems that can lead to blindness. Your healthcare provider will check your vision before and during treatment. Report new or worsening vision changes right away, including blurred vision, vision loss, dark spots in your vision, or any other vision changes. Koselugo can cause diarrhea, vomiting, nausea, and mouth sores. Diarrhea can be severe. Report the first episode of diarrhea right away. Your healthcare provider may give you medicine to help control your diarrhea and may tell you to drink more fluids. Koselugo can cause severe skin rashes. Report any rash that covers a large area of your body, flat skin rash, raised bumps on your skin bumps that look like acne, blisters, peeling skin, itchy rash, hair thinning, or hair loss. Koselugo can cause increased level of an enzyme called creatine phosphokinase, or CPK, in your blood and severe muscle problems. This may be a sign of severe muscle damage. Increased level of CPK in the blood is common during treatment and can also be severe. Your healthcare provider should do a blood test to check your blood levels of CPK before starting and during treatment, and report any muscle aches or pain, muscle spasms or weakness, or dark reddish urine to your healthcare provider right away. Your healthcare provider may change your dose, temporarily stop, or permanently ask you to stop taking Koselugo if you have any of these side effects. Before taking Koselugo, tell your healthcare provider about your medical conditions, including if you have heart, eye, or liver problems. If you are female and can become pregnant, your healthcare provider should check to see if you are pregnant before you begin treatment. You should use effective birth control during treatment and for 1 week after your last dose. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment. And if you are male with female partners who can become pregnant, you should use effective birth control during treatment and for 1 week after your last dose. If you are breastfeeding or plan to breastfeed, do not breastfeed during treatment and for 1 week after your last dose. Talk to your healthcare provider about the best way to feed your baby during this time. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, or herbal supplements. Certain medicines may affect the way Koselugo works, especially tell your healthcare provider if you are taking a supplement containing vitamin E, aspirin, blood thinners, or other medicines to treat blood clots. Koselugo capsules contain vitamin E, which may increase the risk of bleeding. Avoid St. John's wort, grapefruit or grapefruit juice, and Seville oranges during treatment. And the most common side effects in children include vomiting, diarrhea, increased level of an enzyme called CPK in your blood, dry skin, redness around the fingernails, nausea, skin bumps that look like acne, and fever. The most common side effects in adults include rash, diarrhea, skin bumps that look like acne. While these are not all the possible side effects of Koselugo, they are some that could potentially happen, and we encourage you to report any side effects to your healthcare provider as soon as they appear. So let's talk a little bit about Alexion. And I'd like to just share with you that Alexion has over 30 years of treating rare disease. And we're here to help you no matter where you are in your journey. So we believe it's our responsibility to listen, understand, and engage with the NF1 community. And at Alexion, people living with plexiforms are always on our minds, and we know that families need more than treatment. So if you're interested in learning more about Alexion's patient support system, we've created dedicated teams to provide direct support for you and your family. If you want to scan the QR code, it'll take you to koselugo.com where you can learn more about our patient services. So Alexion has 2 distinct patient service teams that are ready to help you and your family from understanding your healthcare insurance coverage and connecting you with community resources. Alexion provides a free assistance to you and your family through our team of support specialists available at any step of your journey. Whether you're newly diagnosed and learning more about NF1 or considering Koselugo as a treatment, or you're starting Koselugo, we have team members that are here to support you throughout your way. One of those team members is patient education managers, or PEMs, like myself, and we help by hosting national educational webinars like this one, partnering with patient advocacy groups like CTF, and coordinating one-on-one or group interactions depending on your needs. We can meet with you one-on-one live or virtually, and we're here to support you no matter where you are in your journey. If you are considering taking Koselugo or you've been prescribed Koselugo, you may connect with one of our case managers, and they help by navigating insurance coverage, answering treatment-related questions, including side effects and how to get access to your medicine, and addressing any financial concerns that you may have. The QR codes on the screen there are available to you if you'd like to connect with your local PIM. You can scan the QR code underneath the PIM, the Patient Education Manager icon there. And if you'd like to connect with the case manager or learn more about enrolling in OneSource, you can scan the QR code there to connect with a case manager. And with that, I'm going to pass it over to Dr. Mina Lobbous and let him do a better introduction of himself, and then we'll get started with today's presentation.
Thank you, Joe, and thanks everyone for your time this afternoon for CTF giving us this opportunity. So this program is sponsored by Alexion Pharmaceutical, and I'm being a paid speaker. This is for educational purposes only. It's not to take the place of the discussion with your doctor. And if you have any question, as Joe mentioned, happy to answer. But if you have a specific question about your condition, make sure you talk to your doctor. So what we're trying to cover today is, so what is neurofibromatosis type 1? What are plexiform neurofibromas? How does the MEK inhibitor work? How did we learn about the safety as well as the efficacy that led to the FDA approval? So let's start by understanding NF1 Plexiform Neurofibromas. NF1 is a rare genetic disorder. It affects about 1 in 3,000 people, 1 in 3,000 people worldwide. So in the United States, there is about 100,000 people living with neurofibromatosis type 1. It can lead to different tumors in different location. One of the most common manifestations of NF1 is plexiform neurofibromas, and about 50% of people with NF1. These tumors are non-cancerous, but they still can cause multiple medical problems, as we will review in next slides. Plexiforms are again, they're a type of tumor, type of nerve sheath tumors, meaning they grow on the outside of the nerve. Affect about 50% of all adults with neurofibromatosis type 1. And this picture here on the right is an example of plexiform neurofibroma on the back. They can be deeper that you don't see them. They can be bigger. The location does matter in what symptoms the patient can have. And not all plexiforms are located underneath the skin. Next slide. So where do these tumors grow? They can grow on any nerve in the body. They come from the nerve sheath. So the nerve sheath is this, think of it like the insulation layer around our nerves. So they come out of the nerve sheath and they can grow anywhere on any nerve, extend across multiple nerves, involve, or push on muscles, blood vessels, or other critical structures. So regardless the size, they can be problematic and cause symptoms, again, depend on the location. The most common location for plexiform neurofibromas tend to be the head and neck. And you can imagine, the symptoms in this location can include pain, disfigurement, pressure on the swallowing or the air pathways. Plexiform neurofibromas can also grow on the arms, legs, internally in the pelvis, pushing on the bladder, or the spinal nerve roots as they exit the spine, anywhere across the, like starting from the neck all the way down to the lumbosacral area. The growth can be unpredictable, although these tumors tend to grow faster earlier in life, but nevertheless, they continue to grow over time, with the average growth rate about 16% per year. So it is unpredictable, but if if any changes in the tumor size, you need to bring this to your doctor attention if you notice any changes in between the doctor evaluation. They can grow deeper in the body that you don't see that. So again, evaluation with the doctor and imaging also can help capture that. So early action and early detection of this growth is key in treating plexiform neurofibromas. So how does the impact people living with neurofibromatosis type 1? As I mentioned in a prior slide, they can grow anywhere, and the symptoms really depend on the location. So most common symptoms tend to be pain. It can cause physical impact. Again, if there is pushing on a motor nerve that can cause weakness, on a vision nerve or in the eye that can cause change in eyesight, or if it's deeper, pushing on an airway or a swallowing that can cause problem with breathing or bowel or bladder control issues. With the pain comes the attention, unfortunately, so it can affect our attention span, can affect planning, how do we manage tasks, can cause learning difficulties, and which we can see in children struggling through school years. Also impact on the emotional and social well-being, from the rate of growth, from the pain, from the other symptoms it can cause that may lead to social stigma, can cause anxiety, it can cause depression and other mental issues that people with NF1 may endure because of these tumors. So where solumetinib, Koselugo fit in this treatment journey? Well, we need to understand what are the treatment options before the FDA approval of Koselugo, initially in children and then subsequently in adults. So for years, the only option was surgery, is to resect these tumors. But understandably, you can try to visualize these tumors like they're wrapped around nerve, other critical structure. So sometimes surgery cannot resect this tumor completely. Even with complete resection, there's a risk of these tumors coming back, which goes anywhere from 20% of the tumor, even if the tumor is completely taken out, up to 60 to 70% in some studies if the surgeon is only able to take a small piece out. So these tumors can continue to grow. Also, they tend to be very vascular, like they have a very rich blood supply, so that can increase the risk of bleeding during surgery, increase the risk of infection. And because of the location, it can be challenging for the surgery team to take out the tumor completely, or in rare event, it can cause permanent neurologic damage if the nerve itself is severed. So while surgery is an option, it doesn't work for everyone. And for some patients may not even be possible because of the tumor location, the size, the configuration. So if surgery isn't an option, that's when Koselugo may be an option. So it was the first FDA-approved treatment in children and teens for NF1 Plexiform Neurofibromas. These are that cause symptoms or being symptomatic and cannot be completely removed by surgery. It was approved for children and teens back in April 2020 after the positive SPRINT trials. So there's 5+ years worth of real data, real world experience in children and teens, and overall about 7.7 years of established safety when we look at this population group in children and teens younger than 18. So how does it work? Well, let's take a step back and see how does the tumors form in NF1? So our DNA have this kind of built-in breaking system called the tumor suppressor gene. This what prevents the DNA into going into unregulated growth. In NF1, this breaking system can be malfunctioning. That can cause what we call hyperactivation or overstimulated or unchecked growth through different pathways, including this MAK pathway. And that's how the Koselugo work. It blocks this specific protein called MEK, which lead to, when the MEK protein is blocked, and you're going to see this under the stop sign there, this overactive growth signal is turned down. this overactivated MYC pathway is what can lead to these tumors, multiplying, growing, and leading to the various, different symptoms that can come from these tumor growth. And by blocking this pathway, turning off or turning down this signal, that what can lead to tumors stop growing and eventually shrinking. So it is what we call a targeted therapy, or it's a MYC inhibitor. It's a targeted therapy. It's not a traditional cytotoxic chemotherapy. Sometimes when we hear about tumors and chemotherapy, the first things that come in mind is what we refer to as big gun chemotherapy. These are cytotoxic drugs that's built in a way to damage rapidly dividing DNA. Koselugo doesn't work this way. It's a targeted treatment through the inhibiting the MYC pathway. So I just wanted to make sure that this is clear for our audience. So Koselugo is now approved for adults living with neurofibromatosis type 1 with plexiform neurofibromas causing symptoms. We call these symptomatic neurofibromas that cannot be completely removed by surgery. So it was proven to shrink tumors in adult compared to placebo, which we're gonna talk about in the KOMET trial in the next slide. So as you know, how does the drug make it to the FDA approval so that it's available for patients to use? It goes through different phases to first establish safety. Is it safe, and what are side effects we expect? And then to establish the efficacy. And if it's safe and the effective, then the FDA review all this data and make the determination to either approve the drug or require or request more information. In the Koselugo story here, the KOMET study is the study that led to the FDA approval for adults with symptomatic NF1 plexiform neurofibroma not amenable to complete surgical resection. So the study was designed as randomized control trial. So what does it mean? If when the patients were enrolling in this study, the researcher look at what we call the eligibility criteria, who's eligible to move on and start the study, and it's basically flip of a coin. One group received the Koselugo and one group received placebo. Sometimes we refer to it as a sugar pill. Basically, there's no medication in it. So the study in the KOMET trial here included 145 adults living with NF1, plexiform neurofibromas that cannot be removed. They were split or randomized into two groups. One group received a Koselugo treatment, while the other group received a placebo. And this study was run over a span of a few years in multiple NF centers around the world. And then after 1 year of treatment, those who received or those who were randomized to receive the placebo did what we call crossover, meaning they were given the medication after 1 year of being on placebo. So that's kind of in a nutshell how the study was designed, the randomization as well as the crossover. So after 1 year, everyone was receiving the treatment. Well, each study will have to have a primary goal. What are we trying to achieve? Or what is the primary goal of this study? And that's all decided on before the first patient get randomized to either group. So the primary endpoint or the primary goal for the study is to measure what we call the overall response rate. What is the percentage of patients who receive the drug that either experience tumor disappearance or shrinkage to 20% or more? So in total, what is the percentage of those patients? And this, what we call primary endpoint or the primary goal, this is a goal that the NF community experts agreed to be an objective, that's an objective way to determine drug success. Is it able, does the drug able to shrink these tumors in a 20% or more? So this is a primary endpoint, the overall response rate, and the cutoff was at 16 months of treatment. So looking at the tumor before the patient started the treatment, and then 16 months later, and compare it and see, did the drug do what it was supposed to do? And it's worth emphasizing that the KOMET was the first and largest clinical study conducted to date in adult with NF1 Plexiform Neurofibromas. As I mentioned, 145 patients, and we're going to get to the different groups in the next slide. So after 16 months in the study, first we're going to talk about the efficacy. Did it work? Did the response was the response sustainable? And what side effects that came with it? So to answer the efficacy question, or the primary endpoint, or the primary goal of this study, so 20% of adults saw that their plexiform neurofibromas shrink at least 20% or more with Koselugo. And that was a 14 out of 71 participants. So 20%. The other group, or the placebo group, that was 74 participants, only 5% had this shrinkage. So 20% versus 5%. When we compare these, we call this statistically significant, meaning that is a real effect related to the drug efficacy, not just a random luck, just to put it simply. And that's 71 on the Koselugo group versus 74 on the placebo group. When they looked at these 14 participants who experience shrinkage of 20% or more, how much shrinkage collectively did they experience of their tumor? We call this post hoc analysis, meaning this is not something that was pre-planned before the study started. That was something that the researcher looked at after the study was completed by collecting all the data and look at it ad hoc or post hoc. So on average, the shrinkage was about 37%. So 37% shrinkage in the tumor size in the 14 participants who experienced shrinkage of 20% or more. Next slide. Well, the next question, now that the drug is effective against placebo and it did achieve the primary goal, how long did it take to reach this goal? And was it durable or sustainable? And what are the numbers here? And that's what we're going to talk about in this slide. So among the 14 participants who experienced a shrinkage of 20% or more, half of them saw that their plexiform shrink within 4 months on treatment. So on the study, regardless which groups that the patient is randomized to, the placebo or the Koselugo group, patients will have serial MRIs in about every 4 months or so. And the MRIs get looked at by radiologists. These radiologists do not know what if the patient is taking the medication or placebo, or where they are in the treatment journey. And they look at it compared to the MRI before the patient started the study. So on average, it took 4 months to achieve this goal. That means 50% of the patient may experience a shrinkage before then, 50% later during the treatment journey. What about, was it the response sustained? Well, sustained meaning that it lasted more than 6 months. So out of the 14 participants, 12 of them, or 86%, who achieved the response that lasted more than 6 months. So that's 86% in terms of sustainability. And all the 14 adult participants responded to Koselugo within 11.2 months. Next slide. So now we answer the efficacy question. We answer the sustainability question. What about the side effect? And Joe thankfully went through the side effect per the FDA label. We'll chat more about them, and we'll cover this side effect. But the most common side effect in adults include rash, diarrhea, and skin bumps that looks like acne. These are the most common, not the only side effect. And if you review the paper, review the data, a lot of these side effects happened early in the treatment journey. So it's very important that you communicate with your healthcare providers when you start the medication. Any new side effect, anything out of your normal day-to-day, communicated promptly with your treating physicians. And there are clear guidance of when the medication is paused, continued, lower the dose, what medication that can be used to mitigate certain side effects. And I'm going to get to like how it does take a village to take care of individual with NF1. And big teams that help ensure we're not just capturing, it's not just, getting MRI or doing this, checks for side effect or not, but there are a lot of resources and clear guidance of how side effects can be mitigated throughout the treatment journey. Next paragraph or next slide. I'm sorry. What about the serious side effect with Koselugo? It can cause serious side effect. Again, Joe mentioned several of these, but that can include heart problems. So your healthcare provider will obtain an echo, or it's like an ultrasound on the heart that assesses the pumping function before the treatment and during the treatment. Eye problems. So your healthcare provider will be either assessing or working with ophthalmologists to have regular eye exams before starting the treatment, while on treatment as well. Skin problem, as I mentioned, the skin bumps that look like acne, other type of a skin rash, as well as the GI side effect, including diarrhea, but also other stomach, intestine, and mouth problems. There are different labs that your healthcare provider will check before and during the treatment. While on treatment, one of them is this muscle enzyme called CPK. And Koselugo is known that one of the side effects, it can cause the CPK to be elevated in the blood. So, as I mentioned, there are clear guidance of certain side effect may require your doctor to pause the drug, lower the dose. Certain side effect, especially if they're mild, they can continue at the same dose with some supportive medication. And some side effect may require the permanent discontinuation of the medication. So what did we learn about these side effects from the KOMET study? So 87%, remember the 71 participant that got randomized to the Koselugo group. So 87% did not have to stop or permanently stop the treatment due to a serious side effect. And again, serious side effect, there's specific tables that we will review while in clinic with you of the severity of a certain side effect going from, mild to moderate or severe. But on the KOMET study, 87% did not have to stop or permanently stop the medication. 86% did not need to reduce the dose while they are in treatment, while 27% needed what we call dose interruption due to side effect. Dose interruption meaning your physician want to give your body a break. And depending on the severity of the side effect, how long did it take for the symptoms or these side effects to resolve, they may bring it back at the same dose or at a lower dose. But based on the what we learned from the KOMET study, it was 27% that needed dose interruption. And some of those patients later in the study may have to stop the medication if their body cannot handle it well. Next slide. So now we went over the efficacy, the side effect, monitoring. Well, how is Koselugo being taken? So it comes in two dosing formulation, twice daily, non-interrupted, so every day for consistent daily routine. So it comes in a capsules or oral granules, so capsules, and the dose depend on here we're talking about, adults and sometimes children, depend on the weight, but a lot of time we know the dose we're going to start adults on, but depend on the weight and continuing the dose depend on how your body is reacting to it, if there is any side effect or lab abnormality, how you're responding, all of that. So the capsules are what we call the default. But these are for children and adults who are able to swallow whole capsules. Well, some capsule as big as a thumb, sorry, and some capsule are much smaller. So how big is the capsule? It's about a Tic Tac in capsule size, and it can be taken with or without food, and it's available on 25 milligram or 10 milligram capsules. Well, what about the oral granules? Oral granules, that's for children or adults who cannot swallow a full capsule. And it's basically these granules are opened and sprinkled on a small amount, about 1 to 3 teaspoons of yogurt or fruit puree. It should not be swallowed. Should not be swallowed as a whole. Just sprinkled or puree or yogurt, and it comes in a 5 milligram or a 7.5 milligram oral granules. So, as I said earlier, it does take a village to care for individual with neurofibromatosis type 1 and throughout their treatment journey. From a neuro-oncologist to ophthalmologist, surgeons, plastic surgeon, neurosurgeon, neurologist, primary care, dermatologist. So it's very important that you get plugged in with the right team. So beside your primary care physicians, there is a long list of specialists who participate and are honored to care for individuals with neurofibromatosis type 1. Some patients may need 2 or 3 specialists. Some patients need more. Some patients need less. And that's the value of being seen by an NF multidisciplinary team who can customize, personalize the treatment plan, all your needs based on your individual story. So talk with your primary care physician, other provider, ask for a referral for an NF1 specialist. I thank you all for your time and for the Children Tumor Foundation for all you do to raise awareness and for Alexion supporting this program. And back to you, Joe.
Yeah, thank you, Dr. Lobbous. Such a great overview of Koselugo, and it does take a village. So thank you for sharing that. So now I'd like to share just some resources that are available to you on the Koselugo.com website. So if you're considering Koselugo, we can offer support on how to get started, ways to talk to your doctor. We can help with cost concerns and more. If you'd like more information, you can scan the QR code on your screen. It'll take you to our resources page. On that page, you'll find a doctor discussion guide that you can download for free. And you can use this to help guide your discussions with your multidisciplinary care team. You'll also find the Koselugo brochure that will contain a lot of the information that Dr. Lobbous presented to us today. It'll help you learn more about NF1 Plexiforms in adults and how treatment with Koselugo might help you. Next slide, please. If you're already taking Koselugo, the resources don't stop. You can still benefit from the latest updates and resources that are available to you on the Koselugo.com website under the resources tab. One of those resources is a treatment tracking journal that can help guide some of the discussion with your healthcare provider. You can track your progress throughout Koselugo treatment, log any symptoms, or note any potential side effects so you don't forget to bring those up to your healthcare provider when you speak with them. There's also a personalized support flyer on the website that'll help. You can use this guide to help learn more about the two unique support teams that are available to you through OneSource, that being your patient education manager as well as your case manager that can help navigate any insurance hurdles or anything like that that you may have. The OneSource brochure is on the webpage as well, and it can help you learn about ways OneSource can support you throughout your treatment journey, no matter where you are. And then last but not least, there is a how to take Koselugo guide that will review some of the topics that Dr. Lobbous talked about with taking the medicine. So if you'd like to learn more about that, you can scan the QR code on the screen and get those, or you can reach out to your local PIM and we can get those to you as well. Next slide, please. So Alexion OneSource, we're here to help, and it's a free, and let me repeat that, it's a free support program to help you at each stage of your journey. Once you've been prescribed Koselugo and you're ready to start taking Koselugo, you may be eligible to enroll in Alexion's patient support program called OneSource. There are many benefits, as we've talked about some of those already today, but one of the benefits is a OneSource copay program for eligible Koselugo patients. You can pay as little as $0 for Koselugo if you have commercial insurance. There are terms and conditions, and you must be signed up for patient services through OneSource. You must have commercial insurance, and that means not part of a federal or state-funded healthcare program. And you must be prescribed Koselugo for an FDA-approved indication. You also must reside in the United States or its territories. If you'd like to learn more about the terms and conditions, please scan the QR code. We love those at Alexion with QR codes. So if you want to scan that QR code and learn more about the eligibility requirements, you can certainly do that. Or you can reach out to your dedicated case manager and they can guide you with any additional information you might need. So we also know that NF1 is a challenging journey to go through, and we want you to know that you're not alone. In addition to your case managers and your patient education managers, we'd like to invite you to connect with your peers and to inspire others. So there at Alexion, we have a couple of resources to help you along the journey. One of those is the Peer Connects. Oftentimes it's helpful to discuss NF1 journey with people who've been where you have been and can help understand your journey from a point of view that's similar to yours. If you'd like to connect with our Peer Connects, you can call and register at 765-4747, and they can get you signed up to connect with our Peer Connects program. We'd also like to invite you to share your story and to help educate and inspire others, and we can do that through the NF1 PN STARS program. This is a completely voluntary program, and you can decide how much time you want to commit to this. But if you're interested in sharing your story to educate and inspire others, you can do that by calling that same 888 number or emailing us at mystory@starambassador.com. For either of these resources, you can also reach out to your local PIM and we can get you connected with the correct resources to get you started in either one of these processes. So with that, I'm going to open the line for questions. Cindy, I believe there were some in the Q&A. Do you want me to ask those, or would you like to ask those?
Kate, do you want me to go through them?
No, that's fine. Joe, do you want to present the questions to Dr. Lobbous, or would you like me to do it? Because I can.
Yeah, I can ask them. So this is one I'm not sure that either one of us can answer, but because I'm not an expert in insurances, but am I correct in thinking that Koselugo is considered a tier 3 medication by insurances? Dr. Lobbous, I'm going to default to your expertise here because I'm not sure where it falls in the tiering categories.
I don't know.
Yeah.
Sure. How this is, yeah.
Probably what I would say from the Alexion point of view, if you're considering taking Koselugo and you're signed up for OneSource, your case manager can certainly walk you through where it falls on your specific insurance, if that's a question. The next question is there any evidence that Koselugo inhibits cutaneous neurofibromas as well as plexiform neurofibromas?
I can take on this one.
Yeah.
So the label, the approval is for plexiform neurofibromas. There is no evidence regarding the efficacy in cutaneous neurofibromas. There is a study that I had the honor to work with Dr. Bruce Gorf when I was at UAB and with the team at the NIH, where we try to answer this question specifically. There's a publication on JAMA Dermatology. You can read it. But the study was started, then we went through the pandemic. Accrual was challenging. And mutually with our NIH colleagues, we had to make the difficult decision of closing it because it was very hard to complete it during the pandemic. The results are out there. Cannot answer this question if it effective against this cutaneous neurofibromas or not.
Thank
But it
you.
was published about a year ago or so.
Yeah.
Okay.
Thank you for that one. Next one, I believe, will go to you as well. Was there any evidence collected about whether Koselugo has helped with pain?
Correct. Yes. So all these data were collected. Any clinical trial will have what we call primary goal or primary endpoint, as I explained to you in this particular study with the tumor shrinkage. Then the secondary goals or the secondary endpoint, which include, as I always say, we treat patients, not pictures. So the tumor shrink, but how did this reflect on making people feel better, right? Did it help with the pain? Did it help with quality of life? All of this was collected before the treatment, throughout the treatment. It was looked at on the Koselugo group, randomized group, the placebo group, and then the placebo group, as you know, crossed over. So all this was collected throughout and reported in the KOMET trial results. For the sake of time, we didn't include this today.
Yeah, thank you for that one as well. Next one is also for you, Dr. Lobbous. For adults who remained in response after 6 months, were they still using Koselugo to achieve that result? And then the follow-up to that is also, how long do patients need to stay on the medication?
Let me just take a step back because therapeutic development in general is near and dear to my heart. So we need to understand that when drug is given during a clinical trial, the researchers are looking at certain time point cutoff, 6 months, 1 year, 2 years, so on and so forth. But the drug doesn't stop. So if the patient is having a benefit from the medication, they're responding, they're discussing with their healthcare providers, the researchers, they're continued on the study. So the study went on beyond the 6 month, like as I share with you, like this when we answer, is it sustainable? So in general, again, based on the FDA approval, as long as the patient is responding well to the medication, side effects are mitigated or minimal, they can continue past the 6 month or the 1 year or whatever the data cutoff was. So it doesn't stop right there as long as the patient understand, risk benefit, having close monitoring, and more to come in the future to know about, what happened years after taking, certain medication. I think was another question earlier about or maybe I missed that, how does will it prevent neurofibromas from even forming? And the KOMET trial did not answer this question. Now, this question is more like a natural history study, like those who take the medication, how did the drug affect them down the road? That's more to come in that. But to answer that specific question, yes, it can be taken beyond 6 months, depending on the tolerance, efficacy, discussion with the prescribing provider.
Very good. Next question. The study was conducted on 145 people. How many were male and how many females? And also, was the study limited to only a particular country? Can I ask if those who participated were from the Caribbean? And the final question is, was diet factored into the results? So, for example, those who were perhaps vegan.
Yeah. So let me start from the bottom up here. So for the diet, this I don't believe this data was necessarily collected. Study will have primary goal, secondary goals, and if there is too many moving variables, then data get diluted. So it's hard to build conclusion based on that. So I don't think we have necessarily a concrete definitive result to say how's a drug work or not work in a certain dietary habits. In terms of I don't have the exact number in front of me, but I do believe that male and females were balanced between the two groups, the Koselugo group, the placebo group, tumor size, kind of all of that. I do believe it was multi-institutional. I'm not aware of certain sites that were open in the Caribbean region, but the race, ethnic groups was collected as a part of the background and not background, as a part of the demographic information for study participants.
Thank you. And this one may be for Kate. Also, is there a support group for those of us who have loved ones with NF?
Yeah, no, I'd be happy to answer that. Thank you for the question, Tori. So CTF doesn't run formal support groups for patients and families living with NF, but we have a ton of great ways to get connected and find the support that you're looking for. So I would encourage you to visit our website. You can always reach out to me at the end of every one of these webinars. I put my email in the chat, and so I'd be happy to connect and talk you through some of the ways that you can do that.
Thank you. And this is our last question. I think it's going to go to Dr. Lobbous. For those who discontinued the medication, did the tumors grow back?
And this data was not, was not collected necessarily or published because we didn't know. It's very important that if a patient we start the medication and the patient or the physician decide to, maybe it's not in the patient's best interest to continue. The patient is still followed closely. So we don't have data about how fast, if any, the tumor grow back after stopping the medication. That's another future data that may get released and will be discussed at that juncture.
Yeah. Thank you. It looks like we are all out of questions, Kate. So I'm going to pass it back to you to close us out for today.
Perfect. Thank you both so much. A big thank you to Dr. Lobbous for being here with us today, and to the Alexion team for their generous support of our educational programming here at CTF. We're incredibly grateful for partners like Alexion and the difference it makes in what we can provide and do with and for the NF community. So a big thank you to you both. As I said at the start, this knowledge series is presented every month. We always have a new topic. Sometimes those topics are disease specific and sometimes they are not. We're posting a link in the chat now where you can see the full calendar of events as we continue to develop content in moving forward into 2026. Next month in April will be Dr. Alicia Gomez will be talking about mosaic and segmental NF and schwannomatosis. And if you don't know what those words mean, then you should definitely tune in because she's a fantastic teacher, and I think it will be worth your while. Also, be sure to sign up for the CTF newsletter. This is a great way to hear about everything we're doing in terms of driving research, advancing care, and the resources that you need. Also, want to kind of give a shout out to one of our wonderful volunteers, Kristen, who dropped in the chat just a few great ways that you can get involved with CTF if you're looking for support and connection. And our volunteers are a huge part of that. So we're very grateful to them and all of the work that they do. If you do have questions about this webinar, about any of our resources, or anything that's been said today, please don't hesitate to get in touch with me. My email is in the chat, and I'm always happy to talk with members of this incredible community. So a big thank you to everyone for being here with us today. I hope that we'll see you again in April, and have a wonderful rest of your day. Thanks, everyone. Bye.
Thank you.
Thank you.